Yes. Charaka Chikitsastana, third chapter, Jwara Chikitsita. So very big chapter, and very important chapter in Chikitsastana. So up to here we have seen Swasthya Urjaskara chapters, that is Rasayana and Vajikarana. From now onwards, Arthasya Roganut, Arthasya Roga Prashamanam. So that part will be highlighted from these chapters. So first chapter is Jwara. So Jwara is considered as Dehendriya Manastapi. So it is tapi or increase the temperature or disturb the Deha Indriya Manas. Sarva Roga Agrajo Bali. So it is considered as superior among all the diseases. Jwaraha Pradhanam Roganam Mukto Bhagavata Pura. So already in Nidana Sthana, first chapter, all these description have been described in the Nidana Sthana. So from there, it is summarized, that is what is the Prakruti, what is the Pravrutti, what is the Prabhava, what is the Karana, types, Purarupa, Adhisthana. So all these questions will be asked by Agnivesha. According to the questions, Atreya will answer one by one. So these are all the Paryaya synonyms of Jwara, that is Jwara Vikara. Vikara means general disease, but Jwara is also named as Vikara. Vikara is equal to Jwara, Jwara is equal to Vikara. Roga, Vyadir, Atanka. So all these are Paryaya synonyms of Jwara. What is the Prakriti of Jwara? Prakriti of Jwara is it will cause Jwara or Tapa in Sharira Manasa, and Dehinam Nahi Nirdosham Jwaram Samupasevet. Means in some diseases, it may affect only Sharira or it may affect only Manas, like this. But in case of Jwara, it will affect Sharira, Manas, Indriya, everything. So there is no part in the body, mind, Indriya, etc., which is not affected by Jwara. So that is the Prakriti, nature of the Jwara. So the nature of the Jwara is it will affect all the Dehinam Nahi Nirdosham Jwara Hasumopasere. So it will affect Sharira, Manasa, Indriya, everything. So it's some more characteristic feature or Prakriti is it represents Shaya, Tama, Papma, Mrityu, Yamatmaka. So these are all the Prakriti of the Jwara. Then comes what is the Pravrutti? Pravrutti means cause, how it is origin. Pravrutti of Jwara, it is because of Rudra Kopa, mainly Rudra Kopa. One more is Parigraha, attachment, over attachment. In Vimanasthana, third chapter, Janapada Dvamsa, there is a detailed description about how attachment, Parigraha, will result in diseases. So, in the same context, Jwara is also mentioned. Because of over attachment, if there is any thought of losing that attachment, then it will result in a tapa, then it will result in a one type of disturbance in the mind body that will result in jwara. So that is mentioned in Vimanasthana third chapter. The same thing is mentioned here, parigraha, that is excessive attachment, and Rudra Kopa. A mythological story is mentioned related to origin of the Jwara. So Pravrutti means origin of the Jwara, how Jwara occurred or origin. So there is a details about the story about how Jwara occurred uh, by Rudra Kopa. So just remember Rudra Kopa is an important term. Then what are all the Prabhava of Jwara? So in Usually, Jwara means equal to Pitta or Agni, but Santapa is there. At the same time, Aruchi is there. So if Agni is there, there should not be Aruchi. But in Jwara, there is a Santapa is also there and Aruchi is also there. So this is called as Prabhava of Jwara. Prabhava of Jwara, special characteristic feature of Jwara is it has both Santapa, Aruchi, Trishna, Angamarda, Hrudivyata. These are all the Jwara Prabhava. Janmado Nidanecha Mahatma. This is also one of the Prabhava, speciality feature. That is, it is present at the time of birth, it is present at the time of death. So, this is all the Prakriti, Pravrutti, and Prabhava of Jwara. In Nidhanasthana, already 8 Karanas have been mentioned Vataja, Pittaja, Kafaja, Sanipataja, Dvandvaja, and Agalpita. So, the same thing is mentioned here. So Pururupa of Jura has been mentioned. Alasyam, Nayane, Sastre, Chumbanam, Gauravam, Klama. Not so important for entrance, we can skip it. But in Sushruta Samhita Uttara Tantra, Jara Chikitsatam has been mentioned. In that, Vishesha Pururupa has been mentioned. It is Vataja Vishesha Pururupa, Pittaja Vishesha Pururupa, Kafaja Vishesha Pururupa. You underline that point. You make a note of that point. Vishesha Pururupa mentioned in Sushruta Uttara Tantra. What is the Adhisthana of Jwara? Kevalam sa manaskam means Kevalam means entire body with entire manas. All these are the Adhisthana of Jwara. What is the most specific feature or characteristic feature of Jwara is Santapa Deha Manasu. Santapa Deha Manasa. Next, different classification of Jwara. Sharirika Jwara, Manasika Jwara, Saumya Jwara, Agneya Jwara, Antarvega Jwara, Bahirvega Jwara, ಪ್ರಾಕೃತ ಜ್ವರ ವೈಕೃತ ಜ್ವರ ಸಾಧ್ಯ ಜ್ವರ ಅಸಾಧ್ಯ ಜ್ವರ ಪಂಚವಿಧ ಬೇಸ್ಡ್ ಆನ್ ವಿಷಮ ಜ್ವರ ದೋಷಕಾಲ ಬಲ ಸಂತತ ಸತತ ನಿರ್ದುಷ್ಕ ತೃತೀಯಕ ಚತುರ್ಥಕ ಪುನರಾವರ್ತಕ ಜ್ವರ. So these are all different types of classification of ಜ್ವರ. One by one classification is mentioned. What is Sharirika Jwara? Sharirika Jwara is the Jwara which starts first in the Deha and then it will may project to Manas. Whereas in Manasika Jwara, first it will cause disturbance in the Manas, that is Vaichityam, Arati, Glani. So then it may affect the Sharirika. So that is called as Manasika Jwara. So there is a special mention about Vayu. Vayu is considered as Yogavaha, Yogavahi or Yogavaha. When Vayu is associated with Pitta, it will cause Daha Krat. When the same Vayu is associated with Kapha or Soma, it will cause Shita. So Vayu, along with its association, it will present in a different presentations. So hence it is called as Yogavaha Param Vayu. Samyoga Tumayartaka. Dahakrit Tejasa Yukta Shitakrit Soma Samshraya. Next, there is a description about Antarvega Jura, Bahirvega Jura. Antarvega Jura is characterized by Antardah, Adhika Trishna, Pralapa, Shwasanam, Brahma, Sandhi Asti Shulam. Underline this one. Sandhi Asti Shula is seen in Antarvega Jura, Bahirvega Jura, Dosha Varcho Vinigraha, constipation, oliguria, etc. Whereas Bahirvega Jura is characterized by Adhika Santapa Bahya. External body temperature is more, than the internal. Trushnadinam cha mardavam. Trishna, dehydration, thirst, everything will be moderate compared to Antarvega Jwara. Bahirvega is slightly easily treatable than Antarvega Jwara. Then there is a description about Prakruta Jwara, Vaikruta Jwara. Sharad Rutu, Pittaja Jwara is Prakruta Jwara. Vasanta Rutu, Kafaja Jwara is a Prakruta Jwara. But Pravrut Rutu or Varsha Rutu, Vataja Jwara is Vaikruta Jwara. Which is the Asadya Jwara is Jwara Shinasya, one who is very depreciated. Um, Cachexia is there, severe weight loss is there. Shuna or very swelling is there. Gambira, deep tissues are involved. Dairghya Ratrika. It is called as very difficult night. Dirghakala Anubandhi. Most chronic Jwara, all these are Asadya Jwara. Next, there is a description about Vishama Jwara. So, first one is Santata Jwara. Santata Jwara involves mainly Rasavahi. Rasavaha Srotas is mainly involved. As Rasa is involved, it will affect the entire body. Sarva Dehanuga, Stabda, Jwaram Kurvanti. So, that is called as Santata Jwara. So, it is very acute in nature. It will affect all the major organs, systems, etc. So hence it is very difficult to treat. Nishpratyanika kurute tasmatniya sutusaha. Nishpratyanika means as it affects the multiple organs, mm, hence it is considered as Nishpratyanika means you can't do the treatment. So that is the severity of Santata Jwara. There will be continuous fever. So all the dhatus will be involved, all the mutra, purisha, all the dhatus will be involved except Sweda. All the dhatus, malas will be involved. So that is the characteristic feature of Santata Jwara. Prasadi dhatu, Shodhana should be done. Rasadi dhatu, Pachana should be done. That is the only treatment for Santata Jwara. Next is Satata Jwara or Satataka Jwara. So here the Rakta dhatu will be involved in Satataka Jwara. Here there will be fever in day and night one time. Satataka Jwara. Next one is Anye Dushka Jwara. Anye Dushka Jwara involves Medo Vahasira. So in Anye Dushka Jwara, there will be Jwara in one time in a day and night. Whereas in Satataka Jwara, there will be Jwara in daytime, Jwara in night time. Whereas in Anye Dushka, one time in entire 24 hours. So that is Anye Dushka Jwara. Next one is Trutiyaka Jwara. When it involves asti, it is called as trutiyaka. When it involves majja, it is called as chaturtaka jwara. So in trutiyaka jwara, there will be an interval of 1 day. That is, if jwara is present on first day, then there will be interval of 1 day. That is, in the second day there will be no jwara. There will be jwara on the third day. Whereas in chaturtaka jwara, there will be jwara with an interval of 2 days. That is, jwara will be there on the first day, 2 days, second day, third day, there will be no jwara, and jwara will be seen on the fourth day. So that is the chaturtaka jwara. So in the first set of involvement, Santata Jwara involves mainly Rasadhatu, Satata involves Raktadhatu plus Mamsadhatu, Anyadushka involves Medo Sira, Trutiyaka involves Asti, Chaturtaka involves Majja. So this is the first level of occurrence. Acharya gives one more concept, that is Anyadushka can also be occur because of Shonita, involvement of Shonita. Trutiyaka can also involve or occur because of involvement of Mamsa Srotas. And Chaturtaka can also get involved because of Medu Marga Doshi. So this is the second level of involvement. It's a bit confusing, but you remember the first level of involvement, that is Santata Rasadhatu, Satata Raktadhatu, Anya Dushka Medovaha, Asti Trutiyaka, Majja Chaturtaka. So there are different differences of opinion among the acharyas, also involvement of dhatu in, especially in the Vishama Jwara. How a seed impregnated in the soil at a particular time, it will develop into a sasi or a herb or shrub or a tree. In the same way, Vishama Jwara also occurs because of the uh, ama in the dhatu or the jwara in the dhatu in a particular time. After getting its energy, it will present as a jwara. So adishete yata bhumim bijam kale cha rohati. In the same way, adishete tata dhatum doshaha kale cha kupyate. So dosha involving the dhatu, dosha plus ama involving the dhatu and result in jwara at a particular time. So that is the speciality of Vishama jwara. Next, Trutiyaka jwara is again three types. Kapha Pitta Pradhana Trutiyaka jwara, which involves Trika, lumbosacral area, Kapha Pitta. Prustat Vata Kapha. Vata Kaphaja jwara, Vata Kaphaja Trutiyaka jwara involves Prushta, that is above lumbosacral area, whereas Vata Pitta involves Shiro, Shiras. So three types of Trutiyaka jwara is Kapha Pitta Trikagrahi, Prushta Vata Kapha Atmakaha, Prushta Grahi, Vata Pitta Atmaka Shirograhi. So three types of Trutiyaka jwara, whereas Chaturtaka jwara is two types. One is Jangabhyam involving Shleishmika, Shiras involving Anilaja. So two types of Chaturtaka jwara, three types of Trutiyaka jwara. Next, Dhatukata Jwara has been mentioned. You can make a charts. Dhatu involvement, Rasadhatu involvement causes Bahistapa, Angamarda, Vijrumbana, excessive yawning, Rasagata Jwara, Raktagata Jwara, Ushna Pidaka, Trushna, Saraktam, Stevanam, Mohu, hemoptysis. Daha, Raga, Brahma, Mada, Pralapa, Rakta Samstite. So these are all the presentations of Raktagata Jwara. Mamsagata Jwara will result in Antardaha, Srushta Vitakata, excessive evacuation, Dorgandhyam, Gatra Vikshepa, sometimes tonic-clonic convulsions in Mamsagata Jwara. Whereas Medagata Jwara will result in Swedas Tivra, excessive sweating, Pipasa, Pralapa, Vami Abhikshanam, excessive vomiting in Medogata Jwara. Astigata Jwara will result in Vireka Vamanam cha ube. There will be vomiting and diarrhea, loose stools. Vikshepanam cha Gatranam, convulsions in the body. Shwasa in Astigata Jwara. Whereas Marma Chedi Majjaga, Majjagata Jwara will result in Hikka, Shwasa, Kasa, Tamasascha Atidarshanam. Marma Cheda, severe form of pain in Majjagata Jwara. Shukragata Jwara will result in Shukra Moksha, evacuation of Shukra. There are chances of death, Aso Vibhuhu, death. Rasa Raktashrita is Sadhya, Medo Mamsa Gata Asti Majjagata is Krutra Sadhya, whereas Shukragata is Asadhya. So all are entrance points. So next there is a description about Dvandvaja Jwaras have been mentioned. Among them, Shleshma Pitta Jwara is important because of Lipta Tiktasyata, Muhurdaha Muhurshita, Shitam, Muhurdaha Muhurshitam, because of Shleshma Pitta. Sometimes Daha, sometimes Shita. Sudden fluctuation will be there in Shleshma Pitta Jwara. Next, Sanipata Jwaras are almost 13 times, 13 types of Sanipata Jwara has been mentioned. Overall, final conclusion, how to remember these 13 types is one category is among the three doshas, one dosha will be highly vitiated, Vata Pradhana Jwara, Pitta Pradhana Jwara, Kapha Pradhana Jwara, or two doshas will be more predominant, Vata Pitta Pradhana, Kapha Pitta Pradhana, Vata Kapha Pradhana, like this. So these are the three varieties, 13 varieties of Sanipataja Jwara. Next, there is a description about Agantaja Jwara, which is again four types: Abhigataja Jwara, Abhishangaja Jwara, Abhicharaja Jwara, Abhishapata Jwara. Abhigata Jwara is because of traumatic fever, trauma. Abhishanga because of involvement of poisonous gases, poisons, etc. And psychological variations like Kama, Krodha, etc. Abhichara, Abhichara because of witchcraft, black magic, etc. Abhishapa is curse, cursed by saints, etc., by gurus, etc. So that is called as Abhishapata Jwara. Abhigataja Jwara is characterized by Vata and Rakta Pradhana. Abhishanga is characterized by Vata Pitta Pradhana. Abhichara and Abhishapa is characterized by Tridosha Pradhana. So Abhigataja is because of Vayu and Raktam. Abhishanga is characterized by Kama, Shuka, Bhaya, Krodha. Because of all these presentations, there will be considered as Abhishanga Jwara or Bhuta Abhishanga. Visha, Vruksha, Anila, Sparsha, etc. Because of contact of allergens, Visha, Vruksha, etc. That is also comes under Abhishanga Jajura. Kamajura is characterized by Dhyana Nishwasa Bahulam, excessive thinking about particular subject, and Shwasa Bahula, Nishwasa Bahula, excessive respiration. So that is the characteristic feature of Kamajura. Next, there are stages of Jura, Amajura, Pachamana Niramajura. अरुचि अविपाक गुरुत्वम उदरस्य च हृदयस्य विशुद्धि तंद्र आलस्य. These are all ama jvara lakshanas. Whereas jvara vegu adhika trushna pralapa shwasanam brahma mala pravrutti. So this is called pachyamana jvara lakshana. Whereas nirama jvara lakshana is characterized by shuddh shamata. There is a desire to take food, lagutvam, lightness of the body. There is no jvara, there is no angamarda, and the intensity of jvara is also reduced. So these are all the presentations of nirama jvara lakshana. So in jvara, main line of treatment is langana because ama is involved, but in some conditions like shayajanya jvara, anila, bhaya, krodha, kama, shoka, shrama, in these conditions, langana should not be carried out. So this is a Chikitsa Sutra of Jvara in Taruna Jvara. So this is important shloka. Langanam Svedanam Kalo Yavagu Tiktakurasa Pachana Doshanam Pachanani Vipakvam Taruna Jvara. So in Taruna Jvara, this is the line of treatment. Langana Svedana Kale Yavagu Tiktakarasa followed by Pachana. So that is the line of treatment in Taruna Jvara. Musta Parpataka Ushira Chandana Udichi Nagara. This is nothing but Shadanga Paniya. Shruta Sheetam Jalam is mentioned. Shruta Sheeta Jalam, boiled cold water reduced to half. That is called as Shruta Sheetam. So that is Shadanga Paniya, useful in Pipasa Jvara. Next, when Vamana should be carried out in Jvara. So these are all the conditions. Kapha Pradhana Jvara, Utklistan, excessive vitiated kapha is present. Excessive kapha is present in Amasya or Urdhva uh, places of body. Doshanam Amashya Sthitam. When doshas are related to Amashya, located in Amashya, then you can do for Vamana. If doshas are not well vitiated to go for Vamana, but still Vamana is done, it may result in Rudrogam, Shwasa, Anaha, Moha. So up to 7 days, Upvasa or Langana can be carried out. Post 7 days, Pachana should be given up to Amapachana will occur. Then Grutapana or Sarpipana should be given. So this is the usual line of treatment. So first is Langana, then is Pachana, and then is Sarpipana. Next, when Virechana should be given, or sorry, Sarpipana should be given, Ata Urdve Kafe Mande. When Kapha is very less, Vata Pittottare Jwara, excessive Vata Pitta Pradhana Jwara is there, and all the doshas are Paripakveshu Dosheshu, that is, there is no Ama condition, then you can go for Sarpipana. Next, when Payasa or Kshira should be given in Jwara, when Daha and Trishna are in high level, Trishna Paritasya, Vata Pittottaram Jwaram, when there is Baddha Kosta or Prachita Kosta, when there is loose stool or constipation, you should give Payas. That is milk. Milk is the treatment for this condition. There should be excessive Daha and Trishna, excessive Vata Pitta Vishesh, either constipation or loose stool. So you can go for Payas, milk. If all these above conditions are done, but still Jwara is not reducing, then go for Virechana. Next, when Stramsana should be given, Pittamba, Kapha Pittamba, Pittashaya Gatam. When the doshas involves Pittashaya, then go for Stramsana. When the doshas are involving the Pakvashaya, you can go for Basti. So, these are all the conditions, that is, conditions for Vamana, conditions for Sarpipana, conditions for Kshirapana, conditions for Virechana, conditions for Tramsana, conditions for Basti. So even though it is mentioned in the context of Jwara, but it can be applied to any disease. Next, when Anuvasana should be given in Jwara, Purana Jwara, when the body is Kshina, Kapha Pitta Pradhana is there, Druda Agni is there, Ruksha Baddha Purisha, dry impacted stools, then go for Anuvasana. When Shirovirachana should be done, when there is a Gauravaya Shirasaha, Shule Vibandham, if there is a opacity in the Indriyas are not functioning properly, heaviness in the Shiras, then go for Shirovirachana. Musta, Parpataka Kasha, these are all the different Kashas which can subside the Jura. Nagara, Parpataka, Durala Kashaya, Kirata Tiktadi Kashaya, Guduchi, Vishwavesham. So different Pachana Kashayas have been mentioned. So this shloka is important. Kalingaka Patola Patram Katakarvini. So this is the Santata Jwara Nashakam, Rasapachakam. Patola Sariva Musta Pata Katakarvini. So this is the Raktapachakam. Nimba Patola Tripala Mrudvika Mustavasako. This is Mamsapachakam. Kiratikta Amruta Chandana Vishwabesha. Medo Pachaka. Guduchi Amalaka Musta. For both Asti and Majja. So all these are five types of kashaya will subset the five types of ವಿಷಮಜ್ವರ, ಸಂತತ, ಸತತ, ಅನ್ಯದುಷ್ಕ, ತೃತೀಯಕ, ಚತುರ್ಥಕ. So based on this five kashayas, Maharashtra, it is a trend that Kalingaka Patolasya Patram Katakuroini. It will does Pachana of Rasadhatu. So any Rasadhatu oriented disease where Pachana is required, you can go for Kalinga Kadi Yoga, Rasapachak. Wherever Rakta is involved, where Rakta Pachana is needed, then go for Patola Sariva Musta Pata Katakuroini, Rakta Pachak. Nimba, Patola, Tripula for Mamsapachak, Kirata Tiktadi, Medopachak, Guduchi Amalaka, Asti Majapachak. So this is the famous trend in Maharashtra where they will do the Pachak treatment, Pachak medicines. They are nothing but these medicines targeting the each srotas or each dhatu. So remember, there is no iti word in all these things, so you can skip most of these medicines. Here there is a Chandanadya Taila, iti Chandanadya Taila. So whenever there is a Ushnata associated with Jwara, you can go for Chandanadya Taila. Next Taila is Agarwadi Taila. Agarwadi Taila is opposite to that. Whenever there is a Shitata, you can use this Agarwadi Taila. Agar.
Hello, sir. One more question, sir.
Huh. It,
In Jora Lakshaditya, in which condition should apply, sir? In Taruna Jara or Vishama Jara?
Jeerna Jwara better, sir.
Jeerna Jara, sir.
Ah, Laksha ಇದೆಯಲ್ಲ,
Lakshaditya.
it
Ah,
is not easily absorb ಆಗಲ್ಲ. So ಜೀರ್ಣ
okay.
ಜ್ವರ, ಅಸ್ಥಿ ಮಜ್ಜ ಅಸೋಸಿಯೇಟೆಡ್ ಕ್ರಾನಿಕ್ ಸಂಧಿಗತ ಎಲ್ಲ ಇನ್ವಾಲ್ವ್ ಆಗಿರುವಾಗ ಬೆಟರ್.
Okay, sir. Thank you.
Next, there is a Karna Mula Shota Jwara. Karna Mula. Sometimes at the end of the Sannipata Jwara, there are chances of Karna Mula Shota, parotitis, or uh, swelling in the parotid gland, etc. So this is one of the complications. It is also mentioned. So in this condition, Raktavasechana, Raktamokshana can be done, followed by Sarpipana. Pradeha application, Kafapittagni, Kavalagraha. So these are all the treatment for Sannipataja Jwarasya Ante Karna Mula Shota Jwara. So this all the different yogas for Vishama Jura. You can skip it. Vishnu Sahasramurtanam Chara Charapatim Vibhum. So some of Daiva Vyapashra Chikisa also mentioned in Jura. That is chanting Vishnu Sahasranama is also one of the important line of treatment. So Nijwara Lakshanam or Purusham Ajwaram means Purusha is completely devoid of Jwara is this all the presentation. Vigata Klama Mana Santapam Avyatam Vimalendriyam Prakriti Satvena. So these are all the features of Purusham Ajwaram. So at the time of Nijwara Lakshana or if Jwara is present in a minimal way, but the patient is taking all nidanas which may aggravate the jwara, then it may result in punaravartaka jwara. So punaravartaka jwara is slightly difficulty to treat because already the patient is vulnerable, already has suffered from jwara, the body is weak, immunity is weak. Again, punaravartaka jwara occurs, it will become a slightly serious condition. So serious treatment is required for punaravartaka jwara. So that is about the Jwara Chikitsitam. So even though many shlokas are there in Jwara Chikitsa, so you concentrate more on conditions or the treatments when it should be done. It is condition suitable for Vamana, condition suitable for Virechana, condition suitable for Basti, Anuvasana, that can be applicable for any other disease also. So first 6 days, 7 days, there should be Langana. Next is Pachana. Next, Sarpipana, Shirapana, Virechana, Basti, all this treatment can be carried out. So that is the line of treatment for Jwara. Move to the next chapter, Rakta Pitta Chikitsitam. Rakta Pitta is considered as Mahagadam Mahavegam, Agni Iva Kshigraka. So it is a Mahagada Mahavega similar to Agni. How a wildfire will spread and engulf entire wide or forest. In the same way, Rakta Pitta will engulf all the Saumya Dhatus, all the Dhatus in the body, resulting in Rakta Pitta. So Rakta Pitta is mainly concentrated on Saumya Dhatus of Rakta, clotting factors of Rakta, vitamins related to Rakta, uh, globulins, hemoglobulins of Rakta, sinusoids, reticular system of Rakta. So all these are concentrated related to Rakta Pitta. So when Pitta acquires the Gandha Guna of Rakta, when Pitta is converted into Rakta, then it is called as Rakta Pitta. Raktavat Pitta is called as Rakta Pitta. So this is the definition of Raktapitta. Samyoga Dushana Tattu Samanya Gandhavarnayohu Raktasya Pittam Akyatam Raktapittam Manishivi. Pitta will acquire the characteristic features of Rakta, then it is called as Raktapitta. So mainly it occurs in Yakrut and Pliha, Plihanam cha Yakrut chaiva tadadhishtaya. And all the Raktavaha Srotas and its Mulas are involved in Raktapitta. Clotting factors, hemoglobulins, vitamin K, reticuloendothelial system. So all these are involved in Raktapitta. So Kapha and with the Raktapitta is Sandra, Pandu, Sasneham, Pichilam. Whereas Vata associated Raktapitta is Shava, Arunam, Safenam, Tanu, Ruksham. Yes. Sorry for the disturbance. There was an emergency call, so I attended. So Rakta Pitta, we were discussing about Rakta Pitta. So these are all the types of Rakta Pitta. Kafan with Rakta Pitta is Sandra, Pandu, Sasneham, Pichilam. Vatan with Rakta Pitta is Shava, Arunam, Safenam, Tanu, Ruksham. So whenever bleeding occurs, its types can be assessed. Kapha Pradhana will be like this. Vata Pradhana will be Shava, Aruna, Safenam. Whereas Pitta associated Rakta Pitta will be Kashayabam, Kashaya color, Krishnam, Gomutra Sannibam. This is the entrance point. Gomutra Sannibam Raktavittam is characterized by or is has a predominance of Pitta Pradhanam. Mechaka, that is carbon soot like Agara Duma, Anjanabam. So these are all Pittaja or Pitta Pradhana Raktapittam. Next, common features Ekadoshanuga Raktapitta is Sadhya, Dvidoshaja is Yapya, Tridoshajam is Asadhya. Next, two types of Gati of Raktapitta, that is Urdhva Gati, which comes from the upper part of the body, bleeding occurring from the upper part of the body, or bleeding occurring downward part of the body. Upward part of the body usually will be associated with the Kapha, downward will be usually associated with Vata. So that is the basic classification of Raktapitta based on Gati. When Raktapitta or bleeding occurs from all the Chidra, from all the Roma Kopa, then it is called as Antikam. Antikam means almost equal to death. So severe form of globinopathies, severe form of clotting factor destructions. So all this considered as asadhyam. Whenever there is a kunapa gandhe, very foul smelling like a dead body, krishnam mativa, very dark color. So these are all also considered as asadhyam. When the person is very kshina, weight loss, kasamana associated with severe cough, that is also called as asadhya. When there is a shifting of margan margam, then it is also asadhya. Snigdha and ushna will cause kapha pradhana urdhogata raktapitta. Ushna and ruksha will cause vata pradhana raktapitta or adhoga raktapitta. When the person is not kshina and bala mamsa is not kshina, when person is slightly capable or when there is no severe weight loss or there is no loss of bala mamsa etc. So in these conditions if there is a bleeding, adu stambana should not be done because here it will be associated with ama condition. So ama plus rakta, if it is very forcefully stopped or stambana done, it may cause severe other diseases, vimarga gamana, causing galagraha, putinasyam, Murcha, Aruchi, Jwaram, Gulmam, Pliham, Anaham, Kilasam, preferably Kilasam. So, in some cases of ladies, uh, they do Stambana or estrogen tablets etc., to postpone the periods, etc., it may result in some skin diseases like some depigmentation, etc. So these are all some of the practical cases we can see. Kruchra mutrata. So clotting occurring in the renal aspect, it will result in Kruchra mutrata, Kushta, Arshas, Visarpa, Varnanasha, Bagandhara, Buddhi Indriya Uparoda. These are all severe form of diseases, Buddhi Indriya Uparodam. So these are all the conditions occur because of Adu Stambhana, when the person is not Akshina Balamamsa and Ama associated. If Stambhana is done, so these are all the complications. When the person is completely Kshina, Balamamsa Kshaya is there and bleeding is occurring, even though Ama associated, but bleeding can be stopped because there is no Balamamsa. So that is the conditions we have to understand. So these are all some of the kashayas, Tribera, Chandana, Ushira, Musta, Parpataka, the kashayas. These are all some of the Shita, Tikta kashayas can be given, which will do Pachana and it will, because of the Shita virya, it will do Rakta Prasadana. At the same time, it can do closely, slowly Rakta Stambhana also. So these are all the kashayas, Kashaya Pradhana kashayas, Shita kashayas, Tikta Pradhana kashayas. These should be given in case of Rakta Pitta. When there is no Akshina Bala Mamsa, the person is slightly fit and Santarpanotita Raktapitta is there, Bahudosha is there, person or patient is Balavata is there, then Kale Samshodhana Raha is there, then you can go for Shodhana. That is Virechana for Urdhva Bhaga Raktapitta and Vamana for Adoga Raktapitta. Chagapaya, that is goat's milk, is the best Anupana or the best Dravya, best diet in case of Raktapitta. Chagapaya. Vasagruta Adhikara. Vasagruta Adhikara Raktapitta. Sometimes there will be bleeding and there will be clotting and causing obstruction, especially in Kantagata. Kantagata, Kafanubandha, Rudire, Sabite, Gratite. Gratite means there is a clot and it will causes obstruction. So in these conditions, Kshara can be used. That is Utpalanala Kshara can be used for obstruction in Kanta because of bleeding. It will causes clotting and then obstruction. So in those conditions, Utpalanala Kshara can be utilized. Next is Shatavariyadi Grutam, Adhikara. So that is about Rakta Pitta Chikitsita.